Hi, my name is Carson, and this is my sports injury webinar on shoulder dislocation. First, I'm going to talk about the anatomy of the shoulder joint. The three bones that make up the shoulder are the scapula, clavicle, and humerus, and the main ones that involve the shoulder joint are the scapula and humerus. The shoulder joint is also commonly called the glenohumeral joint, which is a ball and socket joint because it's the joining of the glenoid fossa and the humerus. The main ligaments are of the shoulder joint are the glenohumeral ligaments, the corticoclavicular ligament, the coracohumeral ligament, the transverse humeral ligament, and the capsular ligaments. The main muscles involved in the shoulder joint are the rotator cuffs. Looking at it closer, it's the supraspinatus, the infraspinatus, subscapularis and teres minor, and the deltoids. The major nerves and arteries of the shoulder joint are the axillary artery, suprascapular artery, axillary nerve, suprascapular nerve, and the lateral pectoral nerve. Here's some pictures to describe what I just said. It shows the shoulder joints, the shoulder bones, and the shoulder muscles. Now we're going to talk about the mechanisms of shoulder dislocations. The types of shoulder dislocations are anterior, inferior, and posterior. The most common types of shoulder dislocations are anterior shoulder dislocations. These injuries commonly occur when the humerus is abducted and rotated laterally via a sudden blow, causing the bone to pop out of the shoulder socket. For example, when blocking a shot in basketball. It can also be caused by chronic shoulder instability, which is caused by someone dislocating their shoulder many times. These are some pictures of what I was just talking about. The first picture being a shoulder dislocation, and the second picture showing like what might cause a shoulder dislocation. Now we're going to talk about the signs and complications of a shoulder dislocation. The signs and symptoms the injured person may have is overwhelming pain, swelling and or bruising, the inability to move the affected joint, and the deformation of the shoulder. What actually happens when someone dislocates a shoulder is the humeral head dislocates from the glenoid fossa, and normally the bone is just displaced, but ligaments and tendons may also be torn. The consequences of a shoulder dislocation is the potential tears in the ligaments and tendons of the shoulder, damage to the blood and nerve vessels around the shoulder, and the increase of shoulder instability. Alright, these are some pictures of what I was just talking about. The first picture showing some dislocations, and the second showing some muscle tears. Now we're going to talk about treating shoulder dislocations. The usual treatments are close reduction, which is basically just gentle maneuvers to help put the shoulder bones back in position. Surgery, which is recommended if you have weak shoulder joints or ligaments, or if nerves or blood vessels have been damaged due to the dislocation. Immobilization, which is like using a splint or a sling to immobilize and stabilize your the affected joint for a few days. Medication, which is usually just pain relief or a muscle relaxant, and rehabilitation. After the shoulder sling or splint has been removed, doctors will recommend a rehabilitation program to help restore mobility, strength, and stability to the joint. Some recommended rehabilitation exercises doctors will give you are shoulder flexions, shoulder blade squeezes, internal rotations of the shoulder, isometric shoulder external rotation, isometric shoulder abduction, and wall push-ups. The estimated recovery period for a shoulder dislocation is a few days in the sling, a complete recovery after 12 to 16 weeks, and a ban from active sport involvement for 6 weeks to 3 months. Active sport involvement meaning like heavy weightlifting or sports that heavily involve you using your shoulder. That's all for my sports injury presentation on shoulder dislocations. I hope you learned something new, and thank you for listening.